A new report out from the Department of Veteran Affairs Inspector General has found that over 300,000 veterans died while waiting for care from VA hospitals and doctors, and that leaves another 600,000 still waiting for care. Here's the thing, guys. I mean, we know we should be taking care of these men and women. They've risked their lives for our country. We all know that freedom isn't free. This is an atrocity. Joining me now, retired Marine Corps Gunnery Sergeant and Senior Fellow at the London Center for Policy Research, Jessie Jane Duff. You know, Jessie Jane, you were mentioned in an article last year in Purple Heart magazine, and this is at the time when this was controversial. This was on the cover of newspapers. It was leading off news stories about the 40 deaths at the Phoenix facility alone. But you alerted the public that this was a lot worse. But I don't know that anyone knew the number could be as high as 300,000.
To me, it was a no-brainer, though, because the evidence over a year ago that I was reading demonstrated rampant negligence throughout the VA, that I knew they couldn't even keep a record of who had died. Simply put, many of the people within the management were delaying appointments and putting on paper that people had only waited 14 days, when in reality they were waiting 30 and 60 and 90 days, or even longer, not getting in to see medical professionals. With that said, I knew it was a no-brainer that people were going to die as a result of being held off. So not only have we had 307,000 veterans die, potentially by the results of this investigation, we have twice that number, almost 600,000, still awaiting care. What is going on? I've known for years, I guarantee people within the VA know this, that veterans are dying at the hands of the very government and the country that they served to defend.
So Jessie Jane, then what do we do? I mean, is this something that's just part of the typical bureaucracy of government? When this was big in the headlines, President Obama talked about it here and there. They gave it some lip service. They looked at maybe perhaps bringing some private sector help to sort of, I guess, to streamline it, but it hasn't changed. Nothing's changed.
No, the VA has been resisting all forms of management change. For example, we had a bill on the Hill that was VA management accountability, that was to allow the secretary to fire employees who were caught up in this debacle of delaying care, altering lists, making it look like people were only waiting 14 days for an appointment. With that said, when you go through the numbers of who's been fired, it only looks like approximately 3 people have been fired. One was an executive, one was Sharon Hellman out of Phoenix, and Secretary Shinseki had to resign. So in essence, many people who were on their hit list managed to retire, get a demotion, or just disappear from the system, like transfer out. So what we're saying is they're not accountable. They're resisting change. They're protecting the executives who have gotten bonuses by making it look like they're running these systems so efficiently and so effectively. Meanwhile, this investigation by the VA's own Inspector General discovered human resources personnel shoving records in desks so that they would not be found. These are veterans' claims that are pending. We also had a veteran that died in 1988 who was still showing to have a pending claim in 2014.
Jessie Jane Duff, you bring the passion, and that's what we need in this country. We got to remember ahead of this 3-day weekend, freedom isn't free. It's people like you, and of course these people waiting on this list who are dying every single day. We'll never let this story go. Appreciate it. Have a great weekend.
Thank you.